Hey y'all, hey. Ooh. Let me make sure I don't have my thing on me. Okay, I don't. Alright, I'm giving y'all some time. Let me actually bring that up. How y'all doing? How y'all doing? Where am I? Right here. Okay. Alright guys, it is time for NCLEX Jeopardy. It is Thursday. Y'all already know what it is. Before we get started with our NCLEX Jeopardy though, I just want to give you guys a quick introduction into our new October campaign. Okay, it's called NCLEX Trick or Treat. Alright, it's very October, fall, Halloweenish inspired. And it's basically, like I said, our October campaign for teaching you guys all the NCLEX tips, tricks, and treats that you need to know. Oh, you see what I did there? Did you see? Sensation said, hey, look, my love, I got accepted to the school of dreams. It's time to use my daughter. Woohoo! Congratulations! Awesome. This is Renee, one of my classmates emailed today. Okay, awesome. Yay. We will check emails again. We check emails typically once a day between our business hours. So she'll have a response by tomorrow. Hi, Tracy Danielle. Hi, Perez. Chanel, you say you need a talk. Leanne said, I just passed my NCLEX. Woohoo, congratulations. Awesome. Jen Rose, you passed too? Kendall graduates as an LP in December. Oh, y'all making me very, very proud. I love it. My ankle's next week. Woohoo. Awesome job. Okay. So, like I said, NCLEX Trick or Treat, that is our free October tutoring session / NCLEX review. You don't have to be directly about to take the NCLEX in order for you to participate. It could be your first semester in nursing school. It doesn't matter. You guys can definitely join for RN and LPN nursing students. We are doing, for the 3 weeks, we are doing nursing care plans this week / the nursing process. And then Sunday is going to be our tutoring session, our live tutoring session on how to write a care plan. So make sure you tune in for that. It's going to be good. And the week after that, it's going to be diabetes, endocrine. And then week 3 is going to be mental health. And then October 30th is going to be our Halloween-inspired NCLEX review game. Something like this, but a little bit more, think escape room. Think virtual escape room, but NCLEX style. Okay, that's going to be our Halloween October 30th review game. And then the 31st, we're going to have a giveaway. Okay, so if you guys want to learn more about NCLEX Trick or Treat, I will go live again later on this week, probably tomorrow, to give you guys a little introduction into it and answer any questions you may have. But for now, we're here for NCLEX Jeopardy, right? It's terrible, just graduated Elpin School, preparing for NCLEX. Woohoo! Then you are in the right place. Has the NCLEX Next Gen come out yet, or is it still the original one? It's still the original one. The Next Gen comes out April 1st, 2023. Okay, so everyone that is taking their NCLEX between now and April 1st, 2023, you'll be taking the current version. Any on or after April 1st, 2023, it'll be Next Gen. Okay, by that time, all of our content, let me not say content, all of our strategy will be geared towards and updated to reflect the Next Gen format. But just know that with Next Gen and current NCLEX, the content still the same. Like diabetes, still gonna be diabetes. Mental health, still gonna be mental health. Those things that you have to know, you're still gonna have to know. Just the way that it's broken down, outlined, and there's different alternative format questions or item formats, which is it's gonna take some getting used to. But as long as you comprehend and know your knowledge, you should be fine no matter what style of NCLEX that is. But we're definitely going to prepare you either way. Okay? All right, so let me bring up my... Hold Let me bring up what you guys are here for. All right, so if this is your first time playing with me for NCLEX Jeopardy, please let me know. Whisper, you never received it? Hold on. Let me send. Okay. Ooh, wait for it. Let me take that down. Whisper. Oh no. Girl, even if I was on vacation, tell me. Let me make sure. Whisper 22. NCLEX Arcade. I could have sworn I sent you. Email us again. Not email, but send me another DM with your email address, just so we can make sure that we have the correct one on file, okay? But anyway, so yes, NCLEX Jeopardy, guys. Let me see if any of my first timers here. Jazz, Bonjour Bell, Perez, awesome. Nursing with Cajun Kells, awesome. So NCLEX Jeopardy is our NCLEX review. Basically, it's our gamified NCLEX review. I created this about 2 years ago. My name is Nurse Sam. Hello. Even though this is your first time at NCLEX Jeopardy, I hope it's not your first time with me. If it is, that's cool. I am Nurse Sam, licensed practical nurse. I created Nurse Sam Global Media, where I create creative study kits and resources for RN and LPN students to get in, through, and out of nursing school, take their NCLEX, pass it, and become great, amazing nurses that I know y'all can be. So because I'm a visual learner, plus when I was in nursing school, I had undiagnosed ADHD. Nursing school was a super struggle for me, okay? There wasn't a lot of content geared towards visual learners, so in a nutshell, I had to make my own. So I like to have fun when I learn. Studies show that when you are entertained, when you're learning, you retain more of that content faster, and you retain it and you're able to recall it faster as well. So I like to make studying fun. That's why we have fun studying, happy studying, okay? So this is your regular NCLEX style questions, okay? We're just doing it in a format where it's a little bit more fun, less overwhelming, and like a game show, in this case Jeopardy, okay? So how we're gonna play, so I'm gonna put up the question, well, I'm gonna choose a question and a point amount. So let's say I wanna do mental health for 200, boom. I'm gonna pull up that question. You guys are gonna read it just like you would the NCLEX. You would read it, answer it, but because this is NCLEX Jeopardy and we're playing for points and prizes, when you answer, you have to answer it in Jeopardy style. So you have to say what is before the answer, okay? Now, the real NCLEX won't be Jeopardy style, but this is just to make it fun, okay? So let's say that the answer is it's going to be multiple choice, either 1, 2, 3, 4. Actually, there may be some select all as well. But 1, 2, 3, or 4, let's say the answer is 3. In order for you to qualify to get those points, if you get it correct in first, you have to say, what is 3? Okay? First person to answer correctly on my screen is going to be the winner of those points. Okay? So, I'm going to say it one more time. First person on my screen. All right? Since we're playing on live, just in case there is... Just in case there is some connectivity issues, maybe who answered second on your screen answered first on mine, and maybe there's just some kind of slight delay. I can only go by what's on my screen, so that person's going to be the winner of the points. All right? I really want you guys to understand that the NCLEX is not Jeopardy style. All right? You don't have to answer first. That doesn't matter. This is really to make sure you guys understand the comprehension, the content material, and the strategies behind how to break those questions down, okay? If y'all have any other questions, please do not hesitate. Please type them down below and let me know. What's said, I'm playing today, route for prizes. That's perfectly fine. If you just want to play, just refresh, and you don't really want to play for points because you don't want to take it away from somebody else that's maybe wanting to play for points and win a free study kit, then you don't put what is. Just put 1, 2, or 3. Okay, but everyone that wants to play for points, the person with the highest score at the end is going to win a free either Ultimate Nursing School bundle or NCLEX Arcade, depending on which one if you have the other one, okay? Like I said, if you just want to play the review, just say the answer, don't say what is, okay? All right, so here we go. All right, guys, so let's go ahead and see what our first question is. All right, so first question, let's go ahead and do fundamentals for 500. Fundamentals for 500 points. Let's just start off strong, okay? All right, this says, a client has a prescription for an injection to be administered by the intradermal route. The nurse should avoid which action when administering this medication? 1, injecting the medication slowly. 2, massaging the area after removing the needle. 3, inserting the needle at a 10 to 15 degree angle. Or 4, making a circular mark around the injection site. All right, so we have people answering. I see some what is 2s. I see some, well, I literally just all see 2s. All right, everyone's saying 2, which is massaging the area after removing the needle. Okay. Now remember, this is a group review, a group testing situation. Honestly, it's the best way to do it for me, okay? Because we all learn from each other. Maybe it's something that I don't understand, but somebody else understands. The way they explain it can be better and can really help you understand the material. So I like studying in a group. However, I don't like study groups. Does that make sense? Anyway. All right, so everyone is saying like 2. Let's see what the answer is. All right. Fundamentals for 500, and the answer is, drumroll please. What is 2? Good job. All right, the answer is, what is 2? Massaging the area after removing the needle. It says an intradermal injection is administered with the needle bevel facing up, all right, at a 10 to 15 degree angle. The medication is injected slowly, and what's called a bleb should form under the skin with injection. After withdrawal of the needle, the area may be patted dry with the 2x2s like sterile gauze. The area should not be rubbed, all right, and that's to prevent the spread of medication beyond the area of injection. Okay, all equipment is then disposed of, and the area of injection is outlined, circled for later reference. Okay, now let's take this a step further. Okay, give me an example of an intradermal injection. Give me an example of an intradermal injection. Intradermal injection. Give me one very common example of intradermal. TB, like the PPD test, not PPP, not the loan, PPD. Okay, that's the tuberculin skin test, absolutely. All right, it goes right up underneath that surface layer, that superficial layer of the skin. They inject a small amount of that medication, and it should form like the nice little, they call it a bleb, but it's really like a little liquid bowl underneath the skin. Okay, and that's what the test is. That test placement is very important, specifically because they're testing for reactivity. All right, you don't want to massage it, you don't want to scratch it, and I say this from personal experience. Okay, because I don't know why you would tell a 5-year-old not to do something, because they're gonna do it. They're 5, so that's what happened to me. They told me not to scratch, and I was just like scratched it. So they didn't. When mine reacted, they don't really know if I reacted because I was exposed or because I was just scratching that thing. Who knows? But they didn't want to take the chance, so I ended up having to take the 9 months of the prophylactic medication anyway, all because I scratched. So yes, TB is an example of an intradermal injection. You do not want to rub it or irritate it in any way, okay? Even putting a Band-Aid on, they don't want you to do that. That's actually very important. All right. Yes, whisper it. A bleb is also called a wheal, not a driving wheel, but WHEAL. It's just a That's the term that it's called when it's on your skin. Okay. First person to get it. AJ said needs to be ran 48 to 72 hours post injection. Absolutely, it sure does. Okay, thank you, AJ. That's AJ is giving you guys an example of clinical thinking. Okay, even though the question was about the correct thing that you do or things that you don't do regarding this type of injection, we went a step further and gave you an example of an injection. And then just to put the cherry on top, we took it another step further and gave you some more interventions, education about that specific type of intradermal injection. All those things you're going to need to know. Okay, so it's best to study like that, especially for nursing school / NCLEX, because you never know how they're going to deliver that material to you. Make sense? All right, so who is the first person to say what is 2 on my screen? Wait, let me go back up. First person it's Renee. All right, it's Renee. Congratulations. You are on the school board with 500 points. It's Renee _ Okay, awesome. No, I'm reading what you guys are saying. No chest x-ray first before therapy. Who, me? Keeping up with Sunny? Are you talking about me? No chest x-ray first? That was my initial test. So after having a positive reaction, you can't get the PPD placement anytime after that because you already had a positive reaction. So then a chest x-ray would be the way to go as far as ruling out TB. But only if you've had a TB test before and it was positive. Okay? All right, great. So let's go ahead and get to the next question. Let me go ahead and get to it. All right, that was what, fundies for 500. Let's go ahead and do. Someone said I learned something new. Listen, every time we play NCLEX Jeopardy, somebody learns something new. It's usually all of us. All right, let's go ahead and get to this next one. All right, let's do. Let's do mental health for 400, especially because we're about to, mental health is going to be one of the topics that we cover during week 3. 1, 2, 3. Yes, week 3 of NCLEX Trick or Treat Extravaganza. So this will be great practice for you. All right, mental health for 400. The nurse is developing a plan of care for a client admitted to the mental health unit with a diagnosis of obsessive compulsive disorder. What is the nurse's priority in the plan of care? Okay, 1, monitor for repetitive behavior. 2, demand active participation in care. 3, educate the client about self-care needs. Or 4, establish a trusting nurse-client relationship. All right. I'm seeing pretty much 1s and 4s. Majority 1s and 4s. I'm seeing majority 1s and 4s. But I'm seeing some 3s as well. Okay. So whenever you have mental health question, well, first of all, any type of nursing school question, but let's specifically talk about mental health. Whenever we have a mental health question, you have to pay special attention to who the client is. Okay, they usually depends on if it's important or not, but they usually let you know, like if it's a mental health question and you're dealing with a specific type of client, they usually give you the diagnosis. Okay, the thing about mental health is that every diagnosis requires a different plan of action, okay, and a different approach because they have different needs. So this particular client has OCD, obsessive compulsive disorder, all right? So we know about that patient. The question's asking us, what is the nurse's priority in the plan of care? Hint, whenever you see what is the priority in a question, more than likely it's not gonna give you like one right answer and then the rest wrong. No. Whenever they're asking for the priority, they're asking for the most correct. I know it's annoying. You probably see it on every meme ever on nursing school, but it's true. Okay? The difficult part about nurse priority questions is that you have to figure out which one is the most correct. And whatever one's going to be the most correct is going to be the one that A, applies to the client, to this client specifically, and B, is going to prevent the most harm and you cause them to be like the most safe. Okay? So think about that whenever you have mental health questions. All right, so let's go ahead and see what this answer is. What is our priority in the plan of care for this client with OCD? Okay, so ask yourself, what do I know about OCD? All right, let me go ahead and go to the answer, and the answer is, drum roll please. What's this? Mental health? Yes. What is 4? What is 4? I am the ambitious one. I see you about to change your answer. Keep it, keep it, keep it. Keep your answers, all right? Another little tip. Whenever you want to change your answer and it's not because of a good reason, like, oh, I misread it or I read too fast. If it's something other than that, then more than likely you're overthinking it and you've talked yourself out of the correct answer. Go with your gut. More times than not, you'll be correct. Okay? All right, so this says, what is 4? Establishing a trusting nurse-client relationship. All right? It says the priority is to establish a trusting relationship with the client. Demanding anything should never occur, or from the client should never occur. That is non-therapeutic communication. Okay? The remaining options are appropriate components of the plan of care, like I said, okay? But they're not the priority. All right? Think about when you think about priority, think about initial, first, all those little buzzwords, okay? What needs to be the first domino that you need to have before asking anything else, okay? Just kind of put yourself in that shoes, just take away the OCD part, as far as that trusting nurse-client relationship. Think about if this question was like, you walking down the street, I don't know, you're walking down the street and some guy comes up to you and it's like, girl, I want to jump your bones or something like that. This is a horrible question. Never mind. But you have to think about the things that needs to happen first before you get there. So if you have questions that just like that, and maybe one answer is like, take me out to dinner first, get my number first, like say hi first. Like what's the very first thing you need to do in order for any of those other things to even happen? Right, exactly. So let's go ahead. Let me see what y'all, let me screw back up. Who said what is 4 first? It's Renee said what is 4 first on my screen. You already have 500 points, love, so you just got another 400. So now you're at 900. Great job. I'm the ambitious one, got it. Whisper. Who else? Giselle, Angie, Allure World, Smiles, Queen Blue, Osama, Kendall, Lisa, Lauren. Hi, boo. She pretty with it. Jasmine Renee. I'm Addie said I'm in between 1 and 4. Well, I hope this lets you guys will kind of solidify why it's 4 and not 1. All right. Just compulsive for no, I answered first. See, on mine, you came before after her. Great job. Zaria said use Maslow's law to decide that answer as well. Maslow's hierarchy. All right. Next question. Y'all ready? So we did fundies, we did mental health. Let's see what our next category is. If you're getting these questions wrong, please do not freak out. That's literally the whole point of us doing this review, so that you can get the questions wrong here and now on Instagram where it don't matter, versus on the actual day of the NCLEX when it actually does matter. Okay, get all the questions wrong here, because honestly, practice really does make progress, and that's the best way, obviously, to study for nursing school / NCLEX exams, because it's really going to be NCLEX style, and so it's going to train your mind to think clinically and think as a nurse, which was really going to happen on the NCLEX. All right, so let's go ahead and do, which one do I do first? Wait for it. Wait for it. Sure, let's do this one. No, this one. Whisper so I spelled out clap. Don't make me laugh. All right, pharmacology, sorry, for 500. A client is prescribed tranylcypromine. There we go. Tranylcypromine. The nurse educating a client about tranylcypromine should instruct the client to avoid which activity? 1. Actually, I'll say it. 1. Drinking any amount of wine. 2. Consuming any fresh dairy products. 3. Exposing the skin of the face to sunlight. 4. Eating either fresh or frozen green leafy vegetables. While you answer that, if any of you are taking the NCLEX Next Gen, which is you're going to be taking your NCLEX on or after April 1st, 2023, one of the biggest changes to the questions is like they almost have like a second part. It's almost like a dual answer. All right, you need to know the reason behind everything. Okay, when I was going through next gen test items to kind of see how the question would be, it would be like this question right here. All right, but then it'd be a why section. Like if everyone that's saying 1, which is drinking any amount of wine, in order for you to also get that question correct, you have to correctly put why. And it'd be drop down. It'd be like it'd still be multiple choice, but you just have 2 different multiple choice questions in one question. Does that make sense? So it'll be like this one. This one will be part 1. And then right below it, it'll have a drop down, saying why. Like, which instructions should the client avoid? 1, 2, 3, or 4. Why? And then you have to choose the correct answer, why. Okay? So for everyone that chose 1, or whenever you're choosing your answers, try to get in the habit of explaining or knowing why. All right? So if you think the answer is 1, tell me why. So it's going to sound like it's going to be much harder. We'll talk about it. I won't say it's harder. It's different. It's different. Okay? But yes, just know your whys, okay? Because it's definitely going to ask you about it. That's definitely one of the driving factors behind the big changes behind Next Gen, okay? All right, let's see. Did everybody put their answer in? Okay, let's go ahead and get the answer to this question. Farm. For, what's this again? 500? Yes. What the hell is it? Hold on, one second. Okay, I was like, where'd it go? Here we go. The answer is 1, drinking any amount of wine. Drinking any amount of wine. Let's go ahead and bring that, back it up, so we can figure out why this is the answer. I said not avoid. Wildfire said not avoid. I don't get it. All right, so what is one? Drinking any amount of wine. All right, so tranylcypromine. First of all, whenever you have a pharmacology question and you see a medication, they're telling you what it is, no matter what, when you're practicing, write that medication down. Just write it down. So after you get through the question, you can go ahead and look that medication up. Okay? So you just refresh your memory. If that's medication you don't know, now you do know. That's how you review and study smarter instead of harder. Okay? So tranylcypromine, what type of medication is that? It's an MAOI, monoamine oxidase inhibitor. All right? And that's used to treat depression. It's an antidepressant, but specifically it belongs to the class MAOIs. All right, that's very important because whenever you hear MAOIs, especially pharmacology wise, instantly in your mind should flash like no beer, no cheese. Like it's certain things that they definitely want to drive into your psyche about certain medications, certain things. It's just commonly tested information. Anytime I see MAOIs, I don't even have to always read it, but I don't even have to finish reading what the rationale is, because more than likely it's going to talk about the fact that one of the very important nursing considerations, interventions, and educations about any type of MAOI is that you need to avoid anything containing tyramine within a 2-week period of taking an MAOI. All right, so foods, fluids, anything containing tyramine, that's what you want to avoid. Okay, remember I said take it a step further? Take it a step further. What foods and drinks contain tyramine? Okay, you need to know that because you may get this question again. And instead of asking, which one you should, like just like this, it didn't say, avoid tyramine. It said drinking any amount of wine. But if you take that a step, if you break it down, wine is fermented. Anything really fermented contains tyramine. All right, wine contains tyramine. And if you need to avoid tyramine, you need to avoid wine. Okay, so that's how you take it a step further and break it down. Clinical thinking, critical thinking. Okay, so what other foods and fluids contain tyramine? If you don't have the Ultimate Nursing School bundle or the first semester bundle or Nurse Eats, which is our diet and nutrition study kit, we have a section specifically on tyramine. It gives you a list of different foods that are high in tyramine and I believe low as well. All right, so aged cheese, smoked or pickled meats or poultry, okay? And you also need to know examples of these types of meats, okay, and examples. So like Allure World, you just said fermented foods. Give me an example. Honestly, give me at least 2. Give me 2 examples of a fermented food. Okay, so if you're going to say something like that, make sure you're able to break it down and really give me specifics of those types of foods / fluids. Okay, aged cheese, smoked or pickled meats. There's actually a specific cheese that's usually always attributed because it's not all. Never mind. I'm gonna take that go. I am that Patty. Pretty. Thank you so much. Lunch meat. Okay. Lunch meat is a type of like a pickled meat. So if you see if they say like a turkey sandwich made with lunch meat or something like that, that's giving you a hint that this is a fermented food that contains tyramine. This is what you want to avoid. All right. Give me some other examples. Tomatoes, plums, eggplant, liver, banana. All right, but the big ones, once again, are aged cheese, smoked or pickled meats, poultry. Another one is pepperoni. Okay, I remember I had a question and it said one of the questions, I think 2 of the answers. Like one was cheese pizza and one was pepperoni pizza. And I had to It was the one with pepperoni pizza was like the one that you definitely want to avoid because they had like 2 doses of something containing tyramine. The cheese and the pepperoni. Actually, hold on. Wait 1 second. Hold on. Okay, so here we go. I'm going to ask y'all another question, actually. So that question that I had, actually, I'm glad I brought it up, about the pizza. It was a trick question, right? Because pizza is usually made with mozzarella. Mozzarella is actually a cheese that contains little to no tyramine. So mozzarella is actually safe. However, an aged cheese like cheddar, Swiss, and like blue cheese, those are the cheeses you want to avoid. So if they gave you an example of like, you know, just a cheese pizza made with like pepperoni, I'm not pepperoni, cheese pizza made with like mozzarella, that's actually fine. But a cheese pizza with pepperoni on it, that pepperoni is going to be what contains that tyramine, not that mozzarella cheese. So, ooh, somebody said low vibration foods, get out. Get out. That is funny. I'm about to pin that. That is funny. You want to comment of the night. That's funny. All right. So liquid wise, beer, wine, liquor, basically anything fun and good. Chocolate, coffee, okay? Anything good. That has tyramine, so you want to avoid that. If you're taking that concurrently or at the same time with MAOIs or within 14 days of the last dose. Okay? Why? Remember that why? Because it can cause sudden and severe hypertensive reactions. Okay? Does anybody know, or is it really called the hypertensive? The hypertensive reaction is literally called hypertensive like crisis. So just know that. So now you have like 2 different whys. Why should you avoid tyramine with MAOIs? What different types of foods are high in tyramine? So those are the ways for you to stair step it. Okay? It's Sharon just said the same thing I said. Cottage cheese and mozzarella safe. You know what another cheese that's safe is ricotta cheese. Okay? That was funny. All right. Next, did I give points? I did not. So who got this one? Let me scroll. Giselle got this one. All right, Giselle, you are on the scoreboard with 500 points. Awesome. Great job to everyone that said 1. Awesome. I have a post to think about that as well, like foods high in tyramine. I'll repost that to my stories as well. All right, let's go to our next question, guys. Pediatrics for 300. Pediatrics for 300, guys. All right. A mother brings her child to the Well Child Clinic and expresses concern to the nurse because the child has been playing with another child diagnosed with hepatitis. The nurse prepares to perform an assessment of the child, knowing that which finding would be of least concern for hepatitis. What's hepatitis? Answer it below. Comment that as after you finish answering, what is 1, 2, 3, 4? Define what hepatitis is. Don't overthink it. Just tell me what hepatitis is. Just break it down. Let's go back and see. Let's not read it too fast. All right. It says the nurse prepares to perform an assessment of the child, knowing that which finding would be of least concern. for hepatitis. Okay, so based on that sentence, we are looking for a finding that would not be indicative of hepatitis. Okay, hepatitis, inflammation of the liver. Itis is inflammation. Hepat, that is the prefix for liver. Okay, so inflammation of the liver. All right, if someone has inflammation of the liver, what kind of clinical manifestations would you expect to see? All right, think about that. What kind of clinical manifestations would you expect to see? And then based on this specific question, you're looking for which is located right here, which finding that the nurse actually found would be of least concern. Jaundice, hepatomegaly, dark colored frothy urine, left upper abdominal quadrant pain. Sorry. Okay. All right, let me see what y'all saying. Let's see what y'all were just saying. A lot of people. Let's see what y'all saying. Yellowing of the skin, yellow skin color. That's jaundice, correct? Right. So everyone that's saying yellowing of the skin, right? We know that's a sign of, something's going on with the liver. Okay? So if we see that finding in that patient, is that going to be of concern or not? Okay? Remember, we're assessing for hepatitis. This patient has not been diagnosed with hepatitis. Okay? What we know based off of our assessment. Okay, and that assessment also includes getting that data collection from a patient history. All right. So right now, the key term or the key word that would really hint towards like their assessment that's really big is that the mother brought her child into the well child clinic, so the child is not actively sick. Okay, this is almost like a prevention not prophylactic, but like I want to be safe than sorry. This is what my concern is. My child is at risk for hepatitis, or something being messed up with the liver because he or she had been playing with another child that's already been diagnosed hepatitis. So right now, we're taking that risk. We're doing our assessment to see whether or not our findings are in line with that of hepatitis. Does that make sense? So let's see what our answer is. P's for 300. Something burning. One second. What is 4? Hold on. Okay. I was like, is something on fire? Sorry, I had to make sure my husband's not burning down the house. I'm gonna see what y'all saying. All right, so yes, the answer is what is 4? Left upper abdominal quadrant pain. That's going to be the finding that would be of least concern. Why? Why, you ask? Let me tell you. All right, so assessment findings in a child with hepatitis, okay, usually includes right upper quadrant tenderness and hepatomegaly. All right, hepatomegaly. What is hepatomegaly? Breaking that down into layman's term, what is hepatomegaly? okay? And when you think about that right upper quadrant tenderness, what side, what quadrant is your liver found in? Your right upper quadrant. Your right upper quadrant. So if I'm expecting to look at your right up, and assess your right upper quadrant to assess for like tenderness, guarding, anything like that, and you tell me no, that's fine, but the left side hurts, least concern. Least concern. All right. As far as the other symptoms and clinical manifestations, it says the stools will be pale and clay colored and urine will be dark and frothy. Jaundice, which is yellowing of the skin, may be present and will be best assessed in the sclerae, which is the white of your eyeballs, nail beds, and mucous membranes. Boop, boop, boop. Especially if your client is African American, you won't be able to see like yellowing of the skin so clearly as you would if that client was not African American. So you usually just want to go for mucous membranes, nail beds, or the sclera, because no matter their nationality or the color of their skin, you can still assess for jaundice the best way using those areas. Okay? Enlarged liver is hepatomegaly. Megaly, think mega, big. Hepato, once again, is liver. So big liver. Enlarged liver, absolutely. Right, liver is not located on the left side. It's located on the right, which is why if they said, oh, my left side hurts, that's not, that would be of little cause for concern, specific to hepatitis. Okay? Does that make sense? Does that make sense? All right. Let's see where's one? Here it is. All right, so see who got that question correct first. The answer is what is for? Let's go ahead and see. First person to say what is for. A lot of people put 1. But okay. Kendall, I believe. Wait, let me go ahead. Let me go up and make sure. Yes. Kendall Villarreal. Awesome job. Kendall Villarreal. You now have 300 points. Awesome. Great job. All right, so It's Renee has 900, Giselle Gill has 500, and Kendall has 300. All right, we still have a few more questions, so it can be anybody's game. All right, let's see who's going to win a free Ultimate Nursing School bundle or NCLEX Arcade. All right. All my people that said for Soul Traduction, Allure World, Mishi 734, Immaculate Michelle, Nikki Nonchalant, Pretty Girl Ange, Kiss My Dimples, It's Shan Shan. Great job. Cannot see the options. If you couldn't see the options, you have to kind of scroll and maneuver the chat so you can kind of see it in between names, just in case it was too small. All right, awesome job, guys. Next question. That was Peds for 300. Let's do not that one. Let's do fundamentals for 200. Fundamentals for 200. All right, hold on. While y'all answering that, let me finish and do this. All right. A client is receiving an intravenous infusion of 1,000 milliliters of normal saline with 40 milliequivalents of potassium chloride. The care unit nurse is monitoring the client for signs of hyperkalemia, which finding initially will be noted in the client if hyperkalemia is present. 1. Confusion. 2. Muscle weakness. 3. Mental status changes. Or 4. Depressed deep tendon reflexes. Okay? There's a couple different things that we need to do. I'm going to walk you guys through it. After you guys drop your answers, don't forget to say what is if you want the points. Leave out what is if you don't care about the points. You just want to answer. All right. Let's go back and dissect the question. Okay? You always really want to really understand what the question is really asking. That's whether you got the new NCLEX or the current. Okay? A client is receiving an IV infusion of 1,000 milliliters of normal saline with 40 milliequivalents of potassium chloride. Okay? Neither of those amounts really, they don't care. They don't really play a role into this question. So don't let that confuse you. Okay? We're getting an IV infusion including potassium chloride. Okay? So that automatically you should be kind of thinking, if I'm getting an infusion, if I'm getting potassium chloride, that means I must have been deficient of it. Okay? Anytime you are receiving something, whether it's you're receiving potassium or you're receiving blood pressure meds to help it go down, anytime you're receiving anything, any type of drug, medication that's replenishing something deficient, a complication is always going to be getting too much. Too much of a good thing is always bad. Okay? Same thing applies to, once again, like drugs and medications. All right? So this nurse, we're looking for signs of hyperkalemia. This goes into assessment. All right? Every time you're looking for signs, you're thinking about what am I assessing? What am I observing? Okay? So if we have a patient with hyperkalemia, we're trying to figure out what that looks like. Okay? So this says, which finding initially will be noted in the client if hyperkalemia, which is what? Is present. Hyperkalemia is what? What is hyperkalemia? And when I say that, I mean like, it just layman's terms. What does hyperkalemia mean? And then take it a step further and give me the range of hyperkalemia. Okay? High potassium. Thank you. I am the ambitious one. Hyperkalemia means high potassium. Hyper means excess, increased, more than, more of. Kalemia, well, emia really means blood, but that Ka, that is potassium. Okay? So if you have too much potassium, we're looking, the question's asking us for the signs that would indicate that someone's having too much potassium. Okay? So which findings initially will be noted in someone with too much potassium? Would they be confused? Would they have muscle weakness? Would they have mental status changes? And would they have depressed deep tendon reflexes? I'm sorry, low vibration foods was funny. Let me unpin that. But that was funny. All right, so potassium's normal lab value is 3.5 to 5, right? That's normal. So if we have too much potassium, that means that the lab value that we would expect to see would be above 5, correct? Okay, I just want to make sure you know, okay? Especially for this new next gen NCLEX. I'm trying to help y'all prepare for both just in case. All right, so let's go ahead and see. right? 3.5 to 5 is normal, so above 5 would be correct. So let's look and see what the initial first signs of hyperkalemia would be. Okay? Now, when you have a question like this, as I pull up the answer, I'm going to explain kind of what your mind should be, how your mind should be like operating, how you should be thinking, and kind of like backtracking this question. Okay? Think about what effects kalemia has on the body. What effects potassium has on the body, and then think about those effects amplified. If you have too much potassium doing its job, too many workers in the field, what would that look like? Okay, so that's how you can kind of think about it as I pull this up. Wait for it. Fundies. The answer is, what is 2? Muscle weakness. Hyperkalemia, too much potassium in the blood, in the body, would result in muscle weakness. Remember what I said, think about the role that potassium plays. It plays a major role in neuromuscular activity. Okay, so an elevation in that serum potassium initially causes muscle weakness. Okay, mental status changes and confusion. Those are most likely noted to be in the client experiencing hypocalcemia, all right, which is low calcium. All right, they love to try to like confuse you. All right, if you ever have a question where it's saying something about hypo, they're going to give you findings, manifestations, and answers basically that's reflecting the opposite. So if you have, for example, we have hyperkalemia, it's going to give you something that's hypokalemia. And then whenever you have kalemia, they usually throw in a calcemia as well, just to make sure you know and you're not mixed up between something that's usually, it's very common to mix those two up. So that's why in nursing school, they usually always trying to get you. Kalemia is potassium, calcemia with a C is kalemia is potassium with a K. Calcemia with a C is calcium. All right, strong bones and teeth, neuromuscular activity. Know the difference because they will try to get, not try to get you, but try to get you. They just want to make sure that you know the difference. All right. Another thing, whenever you see answer choices that are basically the same thing, mental status changes and confusion, they pretty much sound very similar. Okay. Whenever you have similar answers, that it's either going to be one of those. Well, it's either going to be one or both. No, I'm sorry, I lied. It's going to be both, usually. So if you have something that, for example, we just said, like mental status changes and confusion, that's basically saying the same thing. But once again, that is noted in hypocalcemia. But both of them are noted, not just one. All right, so if it's opposite, you have something that's opposite. So if you have like something about hyperkalemia, and then the other answer is like maybe hypokalemia, those are opposites. More than likely, it's going to be one of those answers. Okay, so that's just a little test-taking tip for the current NCLEX and the new gen. Okay, whenever you have opposites, the answer is usually one. If they say the same thing, then whatever answer will apply to both. Okay. Then it says depressed deep tendon reflexes. That's noted in the client with hypermagnesemia. All right. Too much magnesium. Okay. So the answer once again is muscle weakness. Who said number 2 first? And then I'm going to go a bit through what y'all saying. What is 2? What is 2? Who got it first? I am that pretty. Awesome job. All right, so I am that _pretty. Got 200 points. Awesome job. Who also got it? I'm the Ambitious One, Wallflower, Whisper, Shan Shan, Plunky Brewster, Lisa My Boys, Melicia, I Am Addie, Smiles, Osama, Boss Lady, it's Renee, Immaculate Michelle, Allure World, boop, 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 great job. Let me go back what y'all saying. Potassium, Pamela said potassium affects muscles and can create cramps. Mrs. Key says you got 2 as well. Sybil said muscle weakness, decreased reflexes, and tingling. Yeah, you did get it, Osama. Awesome job. So this comes on suddenly, and you have very high levels of potassium. You may feel heart palpitations, shortness of breath, chest pain, nausea, or vomiting. Come on, breakdown assessment. Come on, assessment. Absolutely. So whenever they say like that initially thing, like what symptoms appear initially, you want to think about like how your body's going to react to or how your body's going to compensate to whatever is being deficient or in excess, because your body's homeostasis, the stabilizer, is going to try to once again stabilize your body. So your body's gonna, and like initially at first, your body's gonna try to compensate whatever imbalance it is. In this case, we have hyperclemia, so too much potassium. So our body is going to try to keep up with the demands of that, like fight or flight almost, but they're gonna kind of fight. Our body's gonna try to meet up with the demands of that potassium. All right, so we're just gonna kind of overexert ourselves. So what happens when you overexert yourself? Fatigue, weakness, muscle weakness, especially because it plays a role in neuromuscular activity. That makes sense? Right, Wildflower Osama, I see you. I see you. That is how you study. Y'all better listen. Y'all better listen to Osama. Okay, that is how you study. So that no matter how the NCLEX throws a question your way, because they can ask the same question. I've been doing NCLEX Jeopardy for 2 years, and they ask the same stuff just in different ways. So as long as you understand the content, no more than 1 or 2 signs and symptoms of something, like you really need to know, like comprehend the material, because they're going to ask you in different ways, but it's still going to be about that same concept. How many different ways can NCLEX ask us or assess us on whether or not we know that a potassium of 7 is high potassium? They're going to ask that in so many different ways. They're going to try to see if you know what it looks like on paper / like numerically. They're going to assess whether or not you know how it looks clinically in signs and symptoms. They're going to assess whether you know how to correct it, nursing interventions. That's why nursing school / NCLEX, it's so difficult. They can, same doll, baby, different outfits. So just make sure you really comprehend and understand the content, because they will really make sure to assess you of your comprehension. Okay, absolutely. All right, we have one more to do. Did I give points? I did. One more to do, guys. Then I'm gonna let y'all go. If you want to play the rest of the questions, you can go ahead and download the Nurse Sam app. It's free. It's literally called the Nurse Sam app. I'm going to post the link. Well, if I post the link, will it do it? I'll try. I'll post the link as I put the question up. But yeah, download the Nurse Sam app. You can also search it in your Apple or Android, Google stores, app stores, whatever. Download the app. Go to NCLEX Prep when you open the app. And last week's 25 NCLEX style questions, just like you see here, are going to be still on the app. And then after we get finished with our live, I'm going to update them for 25 new ones to reflect the ones from today. All right, so let's go ahead and do this last one. Dawn? Let's do, which one do I want to do? I think I'm going to do this one, actually. Let's do peds. Allure, will you join what? What was I on? I joined, but it's not allowing me to move to the next. To the next question. Let me know what you mean. Oh, Lexus, I just joined. I know. All right, so this is a new question, guys. This is Peds for 100. If you have TikTok, go over to TikTok, because I'm going to be on TikTok after this. The nurse provides feeding instructions to a client of an infant diagnosed with gastroesophageal reflux disease, GERD. Which instructions should the nurse give to the parent to assist in reducing the episodes of emesis? Do y'all know what emesis means? What does emesis mean? Layman's terms, what does emesis mean? Answer choices are: 1, provide less frequent, larger feedings. 2, burp the infant less frequently during feedings. 3, thin the feedings by adding water to the formula. Or 4, thicken the feedings by adding rice cereal to the formula. Emesis means vomit, throw up, upchuck, however you want to say it. Stomach contents are now out of the stomach. Someone's throwing up. That's what emesis means. It's just a cuter way of saying it. So yes, this is peds. Okay, this is peds. All right, this is a parent of an infant, not a parent of a toddler, not a parent of a child, not a parent of a teenager. Okay, words mean things. Whenever they tell you specifics about the client, especially their age, pay attention. All right. Infant is different than newborn. Just know there's a difference. Okay. Boom. All right. So once again, we have an infant diagnosed with GERD. So reflux. We're the question's asking us to choose the instruction that we should give to the parent in order to assist them in reducing the episodes of vomiting. Okay, so whatever we're about to tell mommy, daddy, whoever, guardian, whatever we're about to say is going to have the function of reducing vomiting. Okay, so this is going to be solution to GERD. All right, so which one of these instructions is going to help lessen the frequency of vomiting in an infant on formula? Okay, provide less frequent, and just break it down. You have an infant, right? We're talking about feedings. Provide less frequent, larger feedings. Okay, so just like you instead of having 3 meals a day, sometimes people are like, I want to have 1 big meal a day or 2 big meals a day instead of 3 smaller size ones. Is that what you're gonna do for an infant? Are you gonna not feed them less but then feed them more? There's a mosquito trying to get me. Anyway, that's number 1. That's what number 1 is saying. Number 2, burp the infant less frequently during feedings. Okay? Is burping the infant less frequently during feeding, is that going to help reduce the episode of vomiting? That's how you gotta formulate the question whenever you're going through these types of questions. Okay? So you don't get confused. 3, thin the feedings by adding water to the formula. Okay, is adding water, is thinning the feedings, is that going to help reduce the episodes of emesis? So, okay, let me take that. Yeah. Okay, before I say the next thing, let's just go on to number 4. 4 is thicken the feedings by adding rice cereal to the formula. Okay, so we're trying to figure out which instruction is going to assist with reducing the episode of emesis. 2 of these answers are the exact opposite. Thin feedings or thickened feedings? Is there like an in between? Is there like a like the 3 bears is porridge? You're trying to figure out like too hot, too cold, just right. No, we have thin, thick. So remember what I said about that test taking strategy. Whenever you have two of the opposite, two answers that say the opposite, more than likely, okay, more than likely, it's usually one of those. Not saying it is for this one, but just keep an eye out on that. Those are test taking strategies that you use concurrently with your content strategies, okay? So let's look and see what our answer is. This is PEDS for 100. I know we went a little bit slower today, but I really wanted to give you guys an example of how to take practice questions for NCLEX. Not just, just go through and do them. There's a strategy behind everything. Okay, I just wanted to teach you guys the best way to get the most out of any study session. What'd I say, Peds? Doot doot. Oh, look, it is one of the two. It's what it's for. Thicken the feedings by adding rice cereal to the formula. Didn't I say that more than likely, when you have two opposites, more than likely one of those two is the answer? 3 was thin the feedings, and then 4 was thicken. Light on, light off. Like, it's got to be one of the two, right? So in this case, it did prove correct again. All right. Now, Gerd, what is Gerd? Gerd is a backflow of gastric contents into the esophagus as a result of relaxation or incompetence of the lower esophageal or cardiac sphincter. Small, more frequent feedings with frequent burping, that's often prescribed in the treatment of Gerd. Okay, so small, more frequent feedings. Remember, an infant's stomach is only about this big. So you saying that you're going to give them more volume, that physically they can't handle that. So that's not how you avoid vomiting. Because if you give them just a big volume, it's going to overflow. What happens when you put too much of something, even if it's one time, if you put a larger volume than the container, it's going to overflow. And it's either going to come up this way and vomit. No, yeah, it's usually this way. I was going to say, or this way and shit. But no, it's going to come up this way and vomit. So that's out. Smaller, more frequent feedings with the frequent burping. Y'all know how, it's right when y'all eating them low vibrational plates, just like Coach Stormy said, before you go back to the other, for your other, like your second hot dog, your second low vibrational plate, you be like, ooh, I need a burp to clear some room. Right? Y'all have said that before. Hands up if you've ever said that. Like, ooh, I just need to burp really quick so I can make room for some more food. You've said that at somebody's cookout. Don't lie to me. Do not lie to me. So yes, think about that, okay? So smaller, more frequent feedings and then frequent burping to kind of make room for more. That's going to help reduce episodes of vomiting. All right? Now, feedings thickened with rice cereal, that may also reduce episodes of emesis, just like I said. Now, if that thickened formula is used, cross-cutting the nipples may be required just because it's a thicker formula, so it's not going to come out like that little itty-bitty hole. So you just need to do I have anything for that? And this is what they mean by cross. Like cross-cut. Like an X-Men sign. Cross-cut. So that when liquid comes out, it's going to come out like a flat. It's going to be like a flat. My fault. All right, so does that make sense? Natalie just said, oh my gosh, I just had this question on my PEDS final. Didn't I tell y'all? They reuse the questions. Like, it's only so many different ways you can ask the same question. So that's why I always urge y'all to come to NCLEX Jeopardy. The numbers don't lie. The passes don't lie. All right? More than likely, you're going to see this question at some point in your nursing career. RN, LPN, professional Ninja Turtle. Who knows? Okay? All right? So who got this one? What is for? Who got that one first? Is my thing? Nope. Who got what is for first? AJ ran it up. Awesome job, AJ. AJ ran it up for 100 points. Awesome. All right, so that was our last question for our Instagram Live NCLEX Jeopardy review. According to my scoreboard, the person with the highest amount of points is, drumroll please, I wanted to submit a drum roll. It's Renee, but we kind of did this. Congratulations, it's Renee. Woohoo! You have won an Ultimate Nursing School bundle. Or if you already have that, because you know you're a visual learner and our tools are bomb for visual learners, you can also get the NCLEX Arcade, unless you have that too. But let me know. All right, so it's Renee with a whole bunch of underscores. Congratulations. Woohoo! All right, so which one would you like, the Ultimate or the NCLEX Arcade? Whichever one you would like, DM me your full name, first and last, your email address, and your prize. So we can go ahead and email that over to you. Congratulations. All right, so everybody else that scored, whether or not you got on the scoreboard or didn't, congratulations and snaps to you, okay? Because like I said, and like I always say, practice makes progress, and it's the best way to prepare for any exam. RN, LPN, LVN, BSN, doesn't matter. It doesn't matter what your kind of program it is, but practicing the NCLEX style questions, that's usually the hardest part, because you don't know, or studying for it, you don't know what to expect. You don't know what lingo they're going to use. You don't know what to study for, what to pay attention to. And the best way to prepare yourself is to take and to mimic those tests. All right. And that's what we do with NCLEX Jeopardy every Thursday, whether we do it live or we do it in the app. All right. We go through about 5 questions, 5 to 10 questions. But if you want to play the full 25 questions, you can download the NurseSam app. Tell you guys, like I said, we do this every Thursday. People that know, we do it even if I'm on vacation, because I surely was in DR and Puerto Rico in Miami, just in my hotel room, like, okay, 1 second, before coming from the pool to help you guys, and then going back to the pool right after. All right, we do it every Thursday. And that's either in my stories. If I can't do it live, I at least put it in my stories with the little quiz stickers so y'all can be interactive and do it. And then I post the rationale once again so y'all know how to do, how to like really answer and understand why the answer is either correct or incorrect. Wait 1 second. Oh, hell. Yeah. You sure did. So the app is called the NurseSam. Boop, 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 boop. Free to download, free to play. Okay. The NurseSam. That's literally what it's called. So yes, if you need the link, I'm going to repost it in my stories. But if you click the link in my bio, you can just click the link in my bio and then click where it says download the app to play NCLEX Jeopardy. That button's, I think, like halfway down that list, that page. But it's clear you should be able to just find it and click it and get to that link. You download it for iOS, Android devices, all that good stuff. And it's interactive. So it's, you know, you have this screen just like I was showing before. Hold on, let me go back to it. Right? You have this screen just like this with your 5 categories, just like this. You have 5 questions per category, so you have a total of 25 questions. Like I said, the questions that are there now are from last week. I'll give you guys about an hour to like play the questions from last week. for all those that are new to downloading the app. And then about 9:30, I'm going to change them over to the questions that we have for the next week. All right, so we change our questions every week. And then I'm going to also put some more questions within my stories. So make sure you guys check out my stories if you want to get a little bit more practice in. Like I said, we do the quiz little sticker thing, so you can be interactive and see if you get it right, wrong, and then you'll be able to see the rationale afterwards. And then same thing with select all that apply, but it'll just be like the little type comment box instead of the quiz, because they don't do select all. All right. Once again, if you guys want to join NCLEX Arcade. Wait, somebody said they liked my shirt. Thank you so much. If you would like it, it is now available. We only do these shirts once a year, okay? We usually do orange or black, and this year you guys voted for black, so it is now available for purchase. Usually our shirt's about $29.99, but for you guys, for this week only, it'll be a low of $24.99, okay? Get your shirts. If you got it, hunt it. That's gonna be a status. Wait, if you got it, hunt it. Okay, had to write that down. That was a cute one. All right. Where was I? NCLEX Trick or Treat. If you guys want to join NCLEX Trick or Treat, you can go and register. Registration is also free. Okay. If you want to get the Ultimate Nursing School Bundle, which is our 400-page bestseller, all right, it is our digital Ultimate Nursing School Bundle. However, you have the option of printing it. And that's the best thing about digital. You forever have the digital version, but if you want to print it 1 time, 2 times, whatever, that is your prerogative. But obviously for personal use only. Thanks so much. Like I said, yeah, we're still doing nursing care plans, and we're learning how to create those. So on Sunday, if you guys have not registered, make sure you sign up for NCLEX Trick or Treat Extravaganza, because on Sunday at 6 p.m., I believe, Sunday at 6 p.m. Eastern Standard, we are learning how to write a nursing care plan, start to finish, step by step. All right, join me for that. Once again, it is free. All right. Want to make sure I'm supporting y'all in any way that I can. All right. All right. Thank y'all so much. I will see y'all next time. Thank you. See you next time. Bye. Love you.